Welcome to our first Chairside Fireside. My name is Matthew Cook. I'm with Arrowhead Dental Laboratory, and it's my pleasure to have with me Hernan Varas, who's our principal teacher for Total Team Training and also one of our voices at this time of confusion with the COVID virus. So Hernan, thanks for being here with us. You will note that we're not in frame together. We are actually on separate sides of the room, so we are observing the social distancing rule, all right? But we do want to get with you guys on a periodic basis to discuss some of the key points that dental practices should be keeping in mind as we all take this journey together through the unknown of this pandemic. And so you're going to see videos from us on a regular basis talking about some key issues and things you should be considering, both in terms of handling your patients with COVID as well as what to do with your practice, both turning it down as restrictions are put in place, but then also what do you do when they start to lift these restrictions and how do you get back into business. So today's topic we're going to be talking about is, I think, one that's really important is the importance of maintaining communication with your patients and just exactly how you go about doing that and what types of patients you need to have in mind as you formulate your strategy. So Hernan, why don't you kind of give us a rundown on what you think we need to be doing as dental practices to be in good communication with our patients?
Well, as we all know and have experienced, this is the biggest curveball that anybody has thrown at us, not only to our industry, but in general, every industry there. One of the things that I feel sometimes is a little lost on what's going to happen, what's happening. And I'm really structured and I already have I schedule things in advance, and your patients also, they're expected to have their cleaning done, some treatment done and everything. And right now, we were called and we were being told that we are going to postpone that for later on. So right now it's critical, first of all, to practice this. When you give people kindness and compassion, they will pay you back with loyalty. So that's what you want to hone on right now. One critical thing that you have to convey, the information you have to give your patients right away is this: we are not closed. We are still open. We'll happen to see emergencies, so if you have any discomfort, please come to see us right away. Call us, and we will accommodate and we'll be able to see you. Don't go to the emergency room, call us first. And of course, you have to screen them. You have to triage them on the phone, and then when they come to the office, to make sure that they don't have the virus or they don't have symptoms.
So that word, communicating with your patients, has been said a lot by a lot of people in the last couple of weeks. I'm curious, from your standpoint, what is key to communication with patients? Is it simply just calling them? Is it sending an email? Is it posting something on your Facebook account that your office is closed? What is effective communication with your patients?
So you mentioned different modalities. I think all of them are important. If you have a social media in your practice, utilize it, Facebook or whatever else you use. If your patients want to be communicated via text or via email, you will know because you already have that relationship with those patients. Please, by all means, communicate via that. I was scheduled to do a physical, I think next week, and they called me from my physician's office saying that unfortunately they have to reschedule my appointment due to the COVID-19, but they were thinking of me and the doctor couldn't wait until we resume to normal so we can do the physical. That meant a lot to me. That meant that they are paying attention to their patients, they pay attention to me because I had the physical. It's the same thing in dentistry. I think we have to reach out to patients, first of all, that were scheduled already and you had to, once again, don't use the word cancel, that you have to reschedule for later on, and patients that have yet to be scheduled, that they're hanging in there. And so we need to communicate with them and tell them that you care, that you're thinking of them, and that you're waiting for the moment that this is back to normal and to take care of them.
So this time right now is unique. I don't think we've ever experienced a work stoppage in any industry, let alone the dental industry, like we are now. And so I'm looking at my relationship with, practitioners in the past, and most of the communication I've had is with the front office. So do you have any kind of special advice you'd give to the doctor and how he should engage his patients now that he has time on his hands?
Absolutely. So, like I mentioned, when we started this, a lot of your colleagues out there, a lot of dentists, they always tell me, if I had the time, we can do wonderful things, but sometimes you get so busy that you don't. So now is when you have the time, there's no reason why you shouldn't be on the phone and start calling those patients. I talked last week with a doctor from Chicago, and she confided in me saying that she was helping her team reschedule patients like a month out. That's what she was doing. And she had all the information from the patients right in front of her. And she mentioned, something I realized when I was doing this is all the things that I haven't talked to them about their condition. And it's now that I have the time, I've started studying, and there's a lot of undone dentistry. They're waiting for me to tell them. So maybe this is a good exercise for you guys to start studying your patients and what you haven't talked to them about.
So what, in your mind, constitutes a communication that is, both meaningful and reaffirms that relationship, especially in a time of such, worry and concern about, health?
Yeah. Well, you cover all the points there that we're supposed to be covering. Mrs. Jones, this is Dr. Let's pretend that I'm a doctor. I'm a dentist. This is Dr. Varas from whatever your practice name is. I'm just calling you and just to chat with you. How you been? And just a little conversation. Just wanted to tell you that I'm thinking about you. I'm thinking about all my patients. And I don't know if you remember, but we always told you that our goal here in our practice is to help you keep your teeth for a lifetime. And right now it's like a little bit of a curveball we all have, but we are looking forward to seeing you whenever we are able to. And I have to tell you that my team will let you know the minute we know we can see you, and then we can reschedule you accordingly. Something as simple as that. To show you care, show that you're thinking of them, and that you haven't forgotten about them. And this is going to be a temporary thing. Because when you call to cancel them, that's what they think. They're being canceled. And the burden of, what's going to happen next, I have to call. No, they're taken care of already. We're going to call you and tell you when you can come in.
Great. Yeah, I think those are some important points that, doctors should take into account. And I really do believe that, like you say, now is a time for doctors especially to reaffirm those relationships, especially where they're not able to see patients as regularly as they have been before. Mm-hmm. That simple call, I think, will certainly translate to more loyalty and a real sense that this doctor cares about my oral health, and when it comes time to reschedule, you'll be more apt to want to go in.
And also, we have to keep in mind this. We're going to be very gun-shy about sterilization and contamination. One of the things that we share at the Total Team Training is one of the key points that you communicate with patients when they come in for the first time, and after a little while too, to remind them that you are very proud of the record of keeping everything sterile, either heat sterilized or hand disposed, that you wipe all the surfaces for their protection, and that obviously, we have always done it that way in dentistry, but you have to remind them. And by the way, you can have a better sterile environment than in our office. We absolutely take pride of absolutely keeping you safe through the different modalities we have, and we have an impeccable record, so you're in good hands when you come back.
So before we were filming, you suggested that as we look to making contact with our patients, that there are 3 principal groups that we should be kind of focusing in on. Could you kind of give us an example, or tell us what those 3 groups are, and then maybe we can get into a discussion on each one of those?
Yeah, there are 2 group of patients that you're going to be seeing. The group we call it proactive list, and then the reactive list. The proactives were patients that were already scheduled, either for a cleaning or for treatment. But due to the new regulation, COVID-19, we have to postpone them. We have to reschedule them. Those are the first ones you're going to reach out. And you're going to, bring them in or let them know, we're thinking about you. Anything that changes, we're going to let you know right away. The second group is the reactive, patients that haven't been scheduled yet, and that you have to put them either for cleaning, most of them are for cleaning if it's reactive. So that is something that you have to start calling on, because you have to start booking when this is over, you have to start booking your schedule. And the third one is patients that you haven't talked for a while, and try to get them in as well. But once again, it will be 3 messages. One, that you're thinking of them, you haven't forgotten them, and they're coming to an environment that is safe for them to be in.
Great. So when we're talking about, patients, you're postponing their treatment, are you advising that you give them a date in the future that you're going to resume operations, or do you leave it sort of an open idea like next month or next quarter, or do you say something like in 4 weeks we'd like to touch base again? How do you suggest that they engage in that?
So let me share with you what I've had conversations with, what they're doing out there, and then I'll give you my recommendation. A lot of our practices are scheduling a month and a half out, because that's when the moratorium per se, if you want to call it that way, is going to be over. So if you're going to do that, make sure you say tentatively, we're going to reschedule at this time, because I know you like mornings. You were scheduled, next week for a morning. We're going to keep that completely like at the same time and everything, but it will be a month and a half or a month from now. And the second one is, it's a good idea to say, we will call you the minute we can get you in. And my recommendation will be to call those patients and saying that, unfortunately, as you know, we couldn't see you for your next appointment. However, let's do this. Let us call you, and we will let you know and secure that appointment, when we can, which is tentatively, and I hope it is, a month or a month and a half from now.
Okay. So let me throw a curveball at you. Let's say like you do try that with a patient, and this patient is overly concerned or maybe justifiably concerned about COVID and the chance for infection. They say, I don't want to schedule anything right now because I don't know what the situation with the virus is going to be. Do you let that patient just kind of be off book for a while, or do you have a message that you try to reaffirm to them to solidify this idea of them coming back in?
First of all, the patient didn't say that they didn't want to come in. The patient told you, I want to wait a little bit, and you have to respect that. Once again, we're going to be very gun shy about what we're going to do in the future. I think that is going to change. However, you're going to respect that. You can say, let's do this. Why don't I call you in a little bit? When will be better for me to call you? And they will tell you, call me when this is over. And I said, well, we will. How about if I call you 30 days from now? And then we'll make sure that everything is secure, and we'll secure your appointment.
Okay. So let me ask you this then. Most practices have a fair number of patients. So are you suggesting that the doctor call all the patients, or is there some sort of prioritization that a doctor should talk to certain patients first and then work their way through the list? Or is this something he does or she does in conjunction with the other team members?
I think both. The first one is, you're going to call anybody that was already in your treatment schedule, your doctor's schedule. You're going to call all of them first. And then you are going to team up with your team, because right now I'm pretty sure you're running a skeleton crew. So you're going to team up with them, and then you can start calling. You're going to be one of those people that call and confirm or reassure them at this time, of need that they have.
And do you think the fact that the doctor is taking part in this forward-facing patient communication changes the attitude of the team as they go about this process, or, I have worked in offices. There's nothing better than having the doctor, having the dentist involved in what we do. It's something charming that they do. It really is. It's part of the team. And also, I think that by dentists doing this, they're going to understand a little bit better how difficult it is sometimes to get somebody on the phone, or some difficult it is to how it is to communicate with patients, and how you have to be aware of different modalities they want to use to be communicated to, or with, I should say. So I think it's important for the doctors to get right down in the trenches with, the front desk to make things work. Great. So, I think we've covered the main concept we wanted to today, the importance that a doctor be involved in actively communicating with his patients, that they look at those three groups that you mentioned, which are those patients that had been scheduled that now cannot be seen because of limitations or because of precautions being taken with the virus, those patients that still need to be scheduled for one reason or the other, and those patients that had pending treatment that you need to have a conversation with.
So we're on the subject. If you have a lot of crown preps that they're in temporaries, start calling those people too. Start calling them to see how they're doing, because once again, it's a temp. If they're in any discomfort, there's no reason why you shouldn't be calling them in, and to make sure that maybe you can cement the crown if they are in discomfort.
Great. So I think the takeaway message is for doctors to be actively engaged in these conversations with patients at this time. They've got the time, right?
They have the time. So I mentioned before, this is my third time. When I have discussions with doctors, they always tell me, I wish I could have the time for that. Now you have it. So I think when we start with a clean slate, it's amazing how you have to restructure right now. and start from zero. And the best way to start from zero is to develop relationships. And if you, in this case, if you're making the relationship bigger than the deal, you win. And if you make the deal bigger than the relationship, you lose.